So welcome to Better Life Chiropractic. We wanted to send you a video right after your examination so that you are more prepared to what to expect in the next visit. This will only take a couple of minutes, but I think it's real important that you have a full grasp of everything because your spinal condition is very, very serious. Just to kind of explain your examination, the first part was the history. We find out as much about your past as we can because even things that happen as childhood can create big problems in the future. You don't realize that your spine can actually be misaligned from a toboggan accident or a fall or something happened in childhood, let alone all the other things that have happened in your life, and they've accumulated to where you are today. And so we're looking to find out how much damage is in your spine and how correctable this really is. So after the history, the second thing and the next thing that we do is a posture evaluation.
So the first portion of your examination, we had you standing up and we were looking at your posture. The reason for that is so that we can look for any sort of structural problems. Now, when I'm talking about a structural problem, and I'm just going to grab this spine here, what I'm talking about is when I'm looking at you from the front, I'm looking for maybe your shoulder, one shoulder being higher than the other. Your hips, maybe one hip is higher than the other. That tells me right there that there's some sort of structural problem going on there and that your body is trying to compensate for that. Then when I look at the side, I'm looking for your head possibly being far forward, which can be causing choking to the spinal cord just by having the damage that's going on in there. Possibly your spine is flattened in the back. These are all things that we're looking for to see, okay, there is a structural problem going in there. The next thing we had you do is we had you lay down on the table and we were pressing along your spine in here, and we were looking for misalignments in the spine and specifically functional problems. So as we're pressing along here, it shouldn't be painful. However, there may have been times when we pressed in there that you had some tender areas. This is where the damage is, and that damage is pressing on your spinal cord, which is choking that spinal cord area. So again, when we're looking at your posture, we're looking for the structural damage, and when we're looking at you laying down, we're looking at the functional damage that's going on with you.
The next thing that we did is take an x-ray of you, because as much as we know where the damage is and we know what the structure is, what we don't know is how much damage is in the spine.
So the way we find out how much damage there is we take an x-ray. So this is a normal x-ray of a person's neck. The patient is facing this way to the left, and what we can see here are these nice beautiful disc spaces and this nice C curve here in the spine. This is a really good example of what a normal x-ray should look like. So what we're going to be doing is comparing your x-rays to this x-ray, and we can see if there's how much damage there is in there. So the amount of damage that we find in your spine could determine how much pressure is on your nervous system and spinal cord.
So what's going to happen when you come in, you'll be welcomed at the front door, and one of the first things we're going to do is have you sit in an area where either Dr. Jasper or Dr. Allison or myself will be doing a general information so you know exactly what it is that not only we do here, how we do it, why we do it. After we're finished with the group portion, we're going to be bringing you into a room privately. That's where I'll go over your case privately with you and your spouse, significant other, or guest. And that's where I'll show you your x-rays, go through your tests, give you my recommendations. And I'll tell you exactly how long it should take, how many visits, any financial investment. We'll go through all of that and answer all your specific questions. So I'm really looking forward to seeing you and your guest or your spouse on your next visit, and we'll see you then.